Well, rather than confront reality, however, Trump is now lashing out at his own experts. Reacting to Dr. Birx's dire warning, Trump said today that, quote, Deborah took the bait and hit us. Pathetic. Trump is also attacking Dr. Fauci for saying the shutdown in the spring didn't go far enough to contain the outbreak. Trump tweeted, wrong, we have more cases because we have tested far more than every other country. But once again, numerous experts and fact checkers have already shown that Trump's claim is simply not true. It seems that Trump would rather ignore the inconvenient truth that the virus is winning. And he's still insisting that schools reopen this fall. And it comes as the Washington Post reports that public health experts are demanding a dramatic reset in the national response, one that recognizes that the crisis is intensifying and that current piecemeal strategies simply aren't working. Joining me now is Claire McCaskill, former senator from Missouri, and Dr. Bernard Ashby, cardiologist and Florida State lead for the Committee to Protect Medicare. Dr. Ashby, I want to start with you first on this question. If, for instance, you did not test for pregnancy, would that mean that you are not pregnant, that maybe you could avoid becoming pregnant by not testing for pregnancy? It's a facetious question, but if you could just respond to it on the basis of coronavirus, because Donald Trump seems to think if you don't test for a thing, the thing goes away.
So, Joy, thanks for having me, first of all. I'm a Florida boy from South Florida. We're happy. We're proud of you, what you're doing. So you're doing big things, as we say down here in the island people.
You.
But
yes,
in terms of this whole discourse, the fact that I'm having to respond to the Trump about clinical medicine is ridiculous. Like, Trump needs to stay in his lane. Like, we went to medical school for a long time. We did training for a long time to speak on exactly what we're experts, what we have the expertise to speak on. And the fact that Trump is inserting himself into academic medicine, clinical medicine, is ridiculous. And he's just saying things that are completely wrong. There's a lot of politicians saying things that are completely wrong. And frankly, me representing medical professionals, we are pissed off. And we want homie to stay in his lane and not speak on medical evidence-based medicine if he doesn't understand it. It's insane.
It is insane. Claire, you have, school superintendents saying they're terrified. They're frankly terrified about the prospect of bringing children back to school when we've seen kids in summer camps get sick and then go home and spread it to who knows who. They're adults in these camps or adults at home, and some of these kids are even being hospitalized. You have Donald Trump's own son goes to a school that is not cleared to reopen. His own youngest son is not necessarily going to be back in school. When you hear public officials going along with this idea that they're going to reopen schools because Trump wants them to, even when scientists are saying it isn't safe, as somebody who is in elected office, can you possibly understand why someone would be more beholden to the president than to the health and safety of their own constituents?
Well, no, especially, Joy, if you take into account how he has botched everything. He has botched wearing masks. He has botched testing. He has botched tracing. He has botched the reopening of businesses and social gatherings. He is now botching the reopening of schools, and his own medical team has abandoned him. First, Dr. Fauci, now Dr. Birx. Last Sunday, she said very clearly masks should be mandated by governors. Well, that's not the Trump line. And then the Admiral, as you just played that segment, he said, forget about hydroxy. It doesn't work. So he is alone on an ignorant island with no science. And the sad thing is, in my state, there are still a whole lot of people that are listening to him and not wearing masks because they think it's showing loyalty to Donald Trump to not wear a mask. And we're having a huge outbreak in our state that is endangering lives of thousands and thousands of people.
And meanwhile, Dr. Ashby, I wish he was alone on that island, but there are people who are listening not just to him, but to doctors who say that, sexual relations with demons can make you sick, then saying, oh, by the way, take hydrochloroquine, it'll work, trust me, and getting millions and tens of millions of people following them. You have people who are now basically COVID deniers. Are you dealing with that in the hospital where you're treating these patients? And how does that impact health professionals when you've got people who simply deny it isn't real?
Another great question, Joy. It's frustrating, okay? So just to give people context, there's 3 high-quality randomized controlled trials, which is a gold standard in medicine when we discuss research that have said that hydrochloroquine has no effect and potential harm. And the fact that we're having this conversation with people who are not medical professionals and people who, for whatever reason, are just turning a blind eye to evidence-based medicine. So you're referring to the one physician that talked about her use of hydrochloroquine for her patients and her use of it for prophylaxis, completely contradicting all the research that we've done that actually had placebo controls that showed that it didn't work. And the fact that she's using her own anecdotal evidence to talk about her outpatient experience and saying that's the way we should do it is just ridiculous. And again, like, I shouldn't be talking about this on this show. Like, this is a conversation we have amongst academics, the people that are treating the patients. We use the best standards of care so that we can have the best outcomes. And it's showing. Patients are doing better with treatment despite the fact that a lot of our leaders are spewing misinformation out there, wasting my time, having me sit here and having to contradict someone that doesn't know what TF they're talking about. I got to use an acronym because I can't curse on here.
Yeah, no, absolutely. I mean, technically it's cable, but I get you. Including the governor of Florida, right? I mean, Claire, I'm going to read two quotes for you, Claire. This is from the Arizona superintendent. This is a school superintendent in Arizona, and this is in the Washington Post. And he says, every time I start to play out what it looks like going back to school on August 17th, I get sick to my stomach. It's not safe. There's no way it can be safe. If you think anything else, I'm sorry, but it's a fantasy. Kids will get sick or worse. Family members will die. Teachers will die. One more quote. This is from the Atlanta Journal-Constitution. And this was a summer camp. The largest school district in the state reported Sunday that 260 employees, this is even the summer camp. This is a school district, Gwinnett County. 260 employees have already tested positive for the coronavirus and are in quarantine because of possible exposure as they prepare for the new school year. So teachers aren't going to get sick, Claire. They're already sick. And you have in the states of Georgia and Florida governors who are much more interested in what Donald Trump thinks of them and what he tweets about them than these pieces of information that are from the people that they are supposed to be governing.
If you look,
go ahead.
If you look, yeah, Joy, if you look at the economic reality of, if you look at the economic reality of a lot of these students, they're in multi-generational families. And they're going to be carriers. They may be okay if they contract it. Many children haven't been, but they're going to be carriers in multi-generational families, and people are going to die. And the public health damage that has been done by this president, we respect public health officials. We revere the information they give us in terms of protecting our health. He has taken a 2x4 to the public health standards in this country. And by the way, in the process, millions of people are losing their health insurance. And while he's in court trying to make sure they cannot get health insurance or have protection for pre-existing conditions by trying to destroy the ACA known as Obamacare.
Yeah. And meanwhile, I think today was the deadline for him to, debut his great new plan for health care. I don't remember seeing it.